everyone. Thank you so much for joining today's presentation on the weekly COVID-19 vaccination reporting for dialysis patients. Our speakers have an excellent presentation prepared for you today, and we will have a time for Q&A at the end. My name is Emily Witt. I'll be helping to moderate the call today, and I just wanted to make a few announcements before we get started. So like I just mentioned, there will be time to answer your questions at the end of the presentation. However, the call is set up as listen only today. So unfortunately, we will not be able to unmute you for you to ask your questions. So we do ask that you submit all of those in that Q&A box that's at the bottom of your Zoom window. Feel free to submit those throughout the presentation as you think of them or at the end during the time for Q&A. Just one other thing to make note of, when you look at your Zoom screen, you will see an option for Q&A and then an option for chat. We ask that any questions related to the content of the presentation you put in that Q&A box. That just allows our speakers to better manage and monitor those questions and increases the likelihood that your question will get answered. If you have questions related to technical issues and that sort of thing, those can be put in the chat, and then we'll have someone monitoring for those as well. Thank you so much again for participating today, and I'm going to turn it over to my colleague Elizabeth to get started.
Thank you, Emily, and welcome to the training session on weekly COVID-19 vaccination data reporting for dialysis facilities. My name is Elizabeth Kyle, and I work in the Division of Healthcare Quality Promotion at CDC. There are 3 objectives for today's webinar. The first objective is to go over the value in reporting weekly COVID-19 vaccination data. Next, we'll review how dialysis facilities can use NHSN to track weekly COVID-19 vaccination data for patients. We will then review data reporting in detail. So now we'll go over how NHSN data can be used to improve COVID-19 vaccination coverage in dialysis facilities. By participating in NHSN, dialysis facilities can report COVID-19 vaccination data for patients each week through the Dialysis Component. Dialysis facilities are required to report data in 2021. For more information on these requirements, facilities are encouraged to contact their ESRD networks. The networks can provide the specific details on when reporting COVID-19 vaccination data through NHSN for healthcare personnel and patients should begin. The NHSN modules are designed to ensure that reporting of COVID-19 vaccination percentages are both consistent over time within a single healthcare facility and comparable across facilities. Using NHSN for monitoring may also result in increased COVID-19 vaccination because improvements in tracking and reporting vaccination status will allow dialysis facilities to better identify and target unvaccinated persons. There are several ways dialysis facilities can put these data to good use and gauge the success of COVID-19 vaccination programs. NHSN now allows facilities to monitor vaccination trends on a weekly basis to see how rates are improving for patients. The data will also show if there are certain groups with lower vaccination rates. For instance, a dialysis facility might note that some patient groups have consistently lower rates of vaccination than others. Or the facility may decide to improve their internal tracking systems, for example, turning to computer-based or automated tracking systems to better identify unvaccinated patients in real time. COVID-19 vaccination data collected through NHSN can also inform decision-making. For instance, the data can provide jurisdictions and partners with critical information, which can then guide COVID-19 vaccination planning and implementation efforts. The data can also help identify and address issues surrounding vaccine supply. In addition, the data can aid public health emergency response activities. For instance, the data may provide insight into vaccine coverage and distribution, thereby informing federal tracking systems. So now we'll briefly go over the data that facilities can report each week. The first question on the COVID-19 vaccination data collection form for dialysis patients requires that facilities report on the total number of all patients receiving dialysis care from the facility during the reporting week. The reporting week runs from Wednesday through Tuesday. Facilities should include all in-center patients and home dialysis patients, such as those receiving hemodialysis or peritoneal dialysis at a site outside the facility. Please note that all questions on the data collection form are based on this population of patients. On the data entry screen for question number 1, facilities are required to enter the total number of all patients receiving dialysis care from this facility. You can see on this slide that the required category is indicated by the red asterisk and box on the data entry screen. It is optional to report the number of in-center dialysis patients and home dialysis patients. So this slide outlines some key points about question 1. Facilities should count patients who are receiving dialysis care during the current reporting week, rather than all patients who have ever been treated through the facility. It's important to remember that dialysis patient categories are mutually exclusive. For question 1, each dialysis patient should be counted only once. If a patient received in-center care and home care during the week, report according to the type of care they received first. For example, if a patient first received in-center care but received home dialysis care later in the week, the facility would report the patient only in the in-center patient dialysis category. Now we'll review how to complete question 2. Question 2 asks for the cumulative number of patients currently receiving care who have ever received COVID-19 vaccine from this facility or elsewhere. So of the patients currently receiving care from the dialysis facility for the week, report on the total number of all patients who have ever received vaccination at the facility or elsewhere since the vaccine became available in December of 2020. In this example, you will see that out of 100 patients receiving dialysis care, 40 have received 1 dose of the Pfizer COVID-19 vaccine, and 5 have received both the first and second doses of the Pfizer vaccine. For question 2, facilities also have the option to report COVID-19 vaccination data on patients based on whether they received dialysis care in the dialysis center or through home dialysis services. So let's go through the steps of reporting vaccination data for question 2. Under question 2, you'll see a drop-down box of COVID-19 vaccines. Click on the drop-down box and select the vaccine for which you would like to report data. At this time, you will see the Pfizer, Moderna, and Janssen vaccines in the drop-down box. You will also see an option to select an unspecified COVID-19 vaccine manufacturer. The second step is to enter the cumulative number of current patients who have received only one dose of the vaccine. So in this example, a total of 40 patients received only dose 1 of the Pfizer vaccine. The third step is to enter the cumulative number of current patients who received both dose 1 and dose 2 of the COVID-19 vaccine. From this slide, you can see that 5 patients received both doses of the vaccine. Entering COVID-19 vaccination data on specific categories of in-center and home dialysis patients is optional. Just remember that if you enter vaccination data for any of the optional patient categories, the number of patients receiving vaccine in that category cannot exceed the total number of patients receiving vaccine. This example shows that a total of 30 in-center dialysis patients received only dose 1 of the Pfizer COVID-19 vaccine. 10 home dialysis patients received only dose 1 of the Pfizer COVID-19 vaccine. This is acceptable as the sum of these two categories does not exceed the total number of 40 patients receiving only dose 1 of the vaccine. Also, the number of patients receiving vaccine in that category cannot exceed the total number of patients at the facility. This example shows that a total of 30 in-center dialysis patients received only dose 1 of the Pfizer COVID-19 vaccine. 5 in-center patients received dose 1 and dose 2 of the Pfizer vaccine. So this is allowed as the sum of these two categories, 35, does not exceed the total number of 80 in-center dialysis patients receiving care during the week. Patients may have received different types of vaccines. If some patients received another type of vaccine, then return to the drop-down box and select the other vaccine. Rows to report the number of patients who have received that specific vaccine will now appear on the data entry screen. Next, please repeat steps 1 through 3 as described previously. So this slide outlines some key points about question 2. Facilities should include patients receiving COVID-19 vaccine at the facility or elsewhere, such as a pharmacy. For those patients receiving vaccine elsewhere, they should provide documentation of COVID-19 vaccination. Please note that the Pfizer and Moderna vaccines require 2 doses for full vaccination. Only 1 dose is given for the Janssen vaccine. If a patient's medical record indicates that they received full COVID-19 vaccination outside the facility, but information for the specific vaccine manufacturer is unavailable, the facility should report these patients in the unspecified manufacturer category. After a facility enters data for question 2, NHSN automatically calculates the number of patients who have completed their vaccinations and are fully vaccinated. In the example on this slide, we see that 5 individuals received both dose 1 and dose 2 of the Pfizer vaccine, while 4 individuals received both doses of the Moderna vaccine. 5 individuals received the Janssen vaccine, while 1 individual was included in the unspecified manufacturer category. Therefore, a total of 15 individuals have completed their COVID-19 vaccination series. And just be sure to report cumulative data each week, rather than only new data for question 2. For instance, 10 patients may have received only dose 1 of the Moderna COVID-19 vaccine during the first week of data collection. During the second week of data collection, 5 more patients received only dose 1 of the Moderna vaccine. Therefore, you would report that at the end of the second week of data collection, the cumulative total of 15 patients received only dose 1 of the Moderna COVID-19 vaccine. Question 3 covers patients with other conditions. Facilities are required to report the cumulative number of patients with a medical contraindication to COVID-19 vaccine. Please refer to the link on this slide for CDC guidelines on medical contraindications to COVID-19 vaccines. Please note that if you enter data for a specific patient category, the number of patients with other conditions in that category cannot exceed the total number of patients with other conditions. So for example, if a total of 2 patients have medical contraindications to the vaccine, the combined number of in-center dialysis patients and home dialysis patients with medical contraindications cannot be greater than 2. The other data entry fields for question 3 are optional. Facilities may choose to report on the number of patients who were offered but declined COVID-19 vaccine. For example, you can include patients declining vaccination because of health conditions that are not considered acceptable medical contraindications to the COVID-19 vaccine. You would also include patients declining vaccination because of religious or philosophical objection. It is optional to report the number of patients with unknown COVID-19 vaccination status. For instance, a facility may not have vaccination documentation for certain patients. Finally, facilities may report the number of patients with a history of laboratory-confirmed SARS-CoV-2 infection. Please remember that when reporting the number of patients with any of these conditions, report the cumulative number of current patients. Question 4 consists of required questions on the availability of COVID-19 vaccines for patients. First, indicate if your facility is enrolled as a COVID-19 vaccination provider. If the facility is enrolled as a COVID-19 vaccination provider, indicate if the facility had a sufficient vaccine supply to offer all patients the vaccine. If the facility is not enrolled as a COVID-19 vaccination provider, indicate if the facility has made other arrangements for patients to receive vaccine. For example, the facility may have a referral system in place for patients to receive COVID-19 vaccination at a health department or pharmacy. Also, CDC encourages facilities to contact their state or local health jurisdiction if there is insufficient supply of COVID-19 vaccine, and if the facility would like to become a COVID-19 vaccine provider. Finally, CDC would like to remind facilities to report any adverse events to the Vaccine Adverse Event Reporting System, or VAERS, using the link listed on this slide. When completing the VAERS report, please enter the facility's 5-digit NHSN org ID in box 26 of the VAERS form, as this will assist with identifying reports from NHSN sites. Serious adverse events include death, life-threatening conditions, or inpatient hospitalization that occur after vaccination, even if it's not certain that vaccination caused the event. Facilities should also report vaccine administration errors. Please note that other clinically significant adverse events may be outlined in fact sheets for provider emergency use authorization or prescribing information. CDC has created a tables of instructions document that provides definitions for all categories and questions on the data collection form. Facilities should review all instructions before collecting and entering COVID-19 vaccination data into NHSN. Please use the link listed on this slide to view the instructions. This slide reviews a data tracking worksheet that CDC has developed for dialysis facilities. This is an optional tool in an Excel spreadsheet format that is designed to help with data collection. Facilities can enter patient vaccination information and select the week of data collection. The worksheet will automatically calculate data that should be reported to NHSN each week. Please note that CDC is currently making a few modifications to the worksheet. We hope to have this reposted to the CDC website by the end of next week, where you can access the worksheet template using the link listed on the slide. In addition to reporting COVID-19 vaccination data for patients through NHSN Dialysis Component, facilities are also able to report weekly COVID-19 vaccination data for healthcare personnel. To report data on healthcare personnel, please use the NHSN Healthcare Personnel Safety Component. Reporting healthcare personnel vaccination data is quite similar to reporting for patients. Facilities report on the total number of healthcare personnel who are eligible to work at the facility for at least one day during the week. For those healthcare personnel, data on COVID-19 vaccination status, vaccine supply, and adverse events following vaccination are reported. Training materials for this reporting can be accessed using the link listed on this slide. So now we'll briefly talk about the steps you will need to take to report weekly COVID-19 vaccination data into NHSN. Once you are on the NHSN landing page, facilities will need to select the dialysis component in the drop-down box. Once you are on the home page for the dialysis component, click on COVID-19 on the left-hand navigation bar. You will then select the weekly vaccination option. You will then see a screen in a calendar format for the vaccination summary data. To report weekly COVID-19 vaccination data, please click on the week for which you wish to enter data. You will then see the data entry screen for reporting weekly COVID-19 vaccination data. Please note that the fields with asterisks and red boxes are required categories. For question 1, enter the number of patients receiving care from the facility during the current reporting week. Next, enter data for question 2 on cumulative vaccine coverage. As shown on this slide, there is a drop-down box to select the type of vaccine administered to patients. All the vaccine options are currently displayed below this box. If a vaccine is selected by mistake, please click on the trash can icon by the vaccine name, and the corresponding rows for that vaccine will then be deleted. After completing data entry for patients, please be sure to click on the Save button at the bottom of the screen. After clicking on the Save button, a message should appear on your screen indicating that data have been saved successfully. Once data have been entered and saved in NHSN, you will see a tab for each existing record on the calendar page. To edit weekly data for patients, click on the COVID-19 Patients tab. The screen with data entered previously will appear. After editing data, please click on the Save button at the bottom of your data entry screen. So now we'll review how to report cumulative COVID-19 vaccination data in more detail. In this example, the facility starts with 50 patients receiving care during the first reporting week. 10 of those patients have received dose 1 of the Pfizer COVID-19 vaccine, while 5 patients have received dose 1 and dose 2 of the Pfizer vaccine. During the second week of reporting, the same 50 patients are still receiving dialysis care through the facility, but now 5 more patients receive dose 1 of the Pfizer COVID-19 vaccine. So for week 1, we have 10 patients who have already received dose 1 of the vaccine. For week 2, 5 more patients receive dose 1. Therefore, for the second week, you would report that a total of 15 patients have now received dose 1 of the Pfizer vaccine. During the third week of reporting, the facility is still caring for the same 50 patients, but now 3 more patients received dose 1 of the Pfizer COVID-19 vaccine, and 10 patients received their second dose of vaccine. So during the second week of reporting, 15 patients received dose 1 of the COVID-19 vaccine. Then 3 more patients received dose 1 of the COVID-19 vaccine during the third week. Of these 18 patients, 10 received their second dose of the vaccine during the third week. Therefore, this leaves us with 8 patients who have received only dose 1 of the COVID-19 vaccine by the end of the third week. Also, for the third week, facilities will report that the cumulative total of 15 patients have received dose 1 and dose 2 of the Pfizer COVID-19 vaccine. To arrive at this number, we would add the 5 patients who received both vaccine doses from week 2 to the 10 patients who received their second vaccine dose during week 3. The next few slides will outline some resources that may be helpful to you. The Dialysis Facility Component website contains links to the data collection forms, tables of instructions for reporting data, training slides, a data tracking worksheet, and CSV file templates and instructions on reporting weekly COVID-19 vaccination data through NHSN. Please note that we will post the updated slides used for today's webinar, along with a recording on the website by the end of next week. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly COVID-19 vaccination in the subject line of your email. This concludes the presentation. Thank you so much for your time.